We have made it to October. That means that it is a Breast Cancer Awareness Month. I'm so happy that I get to be the MC of the Susan G. Komen race this Saturday morning. I can't wait to see a lot of you there. But when it comes to my health reporting, I was trying to think of what is it that women might not know about breast cancer? Because for 35 years, Susan G. Komen has done a great job of making sure we all know the signs and symptoms. We all know to get a mammogram. But I had to think, what would be the one thing that I could tell you as a journalist that you might not have heard before? And I came across something pretty interesting. Another reason that you might want to prioritize early detection and early screening, because I found that the price tag for breast cancer is higher than for any other cancer. The therapies are obviously pricey, but all of those costs like childcare, transportation, supplements, wigs, reconstructive surgery, if you need fertility treatments, all of that adds up. And studies show that half of breast cancer survivors go into debt for years as a result of care, and some spend more than 20% of their annual income on ongoing medical care. That is so unfair on top of everything that you have to go through physically, and that is why health experts say that early diagnosis is equally important when we're talking about your wallet, because they say that after 1 year of diagnosis, it costs a woman about $51,000 for stage 1, compared to $116,000 for stage 4. So you've got to prioritize getting detected early, because it could also save your family from going into debt. And reach out to cancer nonprofit organizations. They are there to help you. They actually have grants for this specific type of thing. If you are feeling overwhelmed by the cost, there's organizations like the Rose. The San Jose Clinic is a great organization if you don't have health insurance. And for anyone diagnosed with cancer, you got to reach out to the American Cancer Society. They have funds to help with this kind of thing, and they can do something really small, like offer you transportation to your appointments or offer to pay for parking at those parking garages that can get so expensive. And I have talked to people who talk about what a huge difference that makes in this life-threatening disease that they're facing. So it might seem like something small and something trivial when you're facing a diagnosis like this, but boy, can that add up and be such a blessing.